Now we are going to see about Fowl's hierarchy of mental illness. It is also called as Fowl's hierarchy of psychiatric symptoms. This is the Fowl's hierarchy model. This helps us to come to a diagnosis from many symptoms of patient. So in this side I mention about the symptoms, and here we mention about the mental illness. When a patient presented with change in the level of consciousness or memory impairment, we put them in the top of this hierarchy model. They go into the diagnosis of organic psychosis. It means we have to think organic pathology for their disturbance. And when they presented with third person auditory hallucination and first degree delusion, they can be categorized as they having schizophrenia. When they have schizophrenia, they won't have the high level of symptoms such as change in the level of consciousness and memory impairment. Then if they have affective symptoms such as low mood, loss of energy, which indicates depression, and when they have elevated mood, increased activity, high energy, which indicates mania, they come into the diagnosis of mood disorders or affective psychosis. Bipolar disorder is an example. If they have symptoms of OCD, in OCD they want to wash their hands, so they want to be clean always and perfect. Or if they have symptoms of anxiety, they will be categorized under minor mental health disorders or neurosis. Some people present to us with an normal reaction to an abnormal situation. Abnormal situation means when they have loss of their relatives or loss of their loved ones, they show grief reaction. This is a normal reaction. So this comes in the bottom level of this hierarchy. So we don't need to give any diagnosis here. And also when they have exams, people feel stress and they shows the symptoms of anxiety. So this is a normal reaction to an abnormal situation. When a patient presented with high level of symptoms, they may also have lower level of symptoms. Example, in schizophrenia, they may also presented with us with depression. So they have third person auditory hallucination as well as delusion. In addition, they may also have symptoms of depression. So this hierarchy, when we consider the higher levels of symptoms, it goes into the top of the mental illness. It means although they have depressive features, we put them into the diagnosis of schizophrenia. And sometimes these patients may present with overlapping of symptoms. It means in the schizoaffective disorder, they have symptoms of schizophrenia as well as depression. So here I mean two levels of hierarchy together. So we can give the diagnosis of schizoaffective disorders, and also mixed anxiety depressive disorder. They may present with depression as well as anxiety. So they sometimes we can see overlaps of symptoms. So when you come across patients according to the symptoms, if you remember this hierarchy model, you can easily come to a diagnosis. Thank you.